Welcome back to the Dr. Jeffrey Tauth Heart Talk Show. I'm Dr. Jeffrey Tauth, and today's show is called Energy Drinks and the Heart: What Young Adults Need to Know About Arrhythmias. And trust me, it's juicier than your cousin's peach cobbler. That energy drink you grabbed this morning could be sending your heart into dangerous, irregular rhythms. I'm seeing more young adults in my clinic with heart rhythm problems, and guess what's sitting on my desk during these consultations? Empty energy drink cans. Yep, entirely true. I can't make this stuff up. Let me tell you about the caffeine overload problem that's got me more concerned than a cat in a dog park. Most energy drinks pack 150 to 300 milligrams of caffeine per can. That's like chugging 3 to 6 cups of coffee in one sitting. Your heart wasn't designed to handle these massive caffeine spikes any more than your car engine was designed to handle rocket fuel. This overload triggers your heart's electrical system to misfire, causing what we call arrhythmias. Basically, your heart starts doing the electric slide when it should be waltzing. Young hearts are especially vulnerable because they're not used to this level of stimulation. It's like taking someone who's never driven and putting them behind the wheel of a Formula One race car. But here's where it gets really interesting. And by interesting, I mean scary as a horror movie marathon. It's not just the caffeine causing problems. Energy drinks combine caffeine with taurine, guarana, and a cocktail of synthetic stimulants that would make a chemistry professor dizzy. This isn't your grandmother's cup of tea, folks. These ingredients work together like a dysfunctional boy band. They amplify each other's effects and overstimulate your sympathetic nervous system. Think of it as your heart's panic button getting stuck in the on position. The result, your heart races, skips beats, or develops rhythm disorders that can be life-threatening. Let me share a real story that'll make your hair stand up straighter than a Marine at attention. Last month, I treated an 18-year-old college student who collapsed during finals week. This kid was sharp as a tack, had his whole future mapped out, but he'd been drinking 3 to 4 energy drinks daily to stay awake studying. When he arrived at my emergency department, his heart was beating 180 times per minute in a chaotic, irregular pattern called atrial fibrillation. His heart looked like it was having its own private rave party, and not the fun kind. We had to use intravenous medications to reset his heart rhythm, all of this drama from energy drink overconsumption. The good news is we caught it in time, but let me tell you, his parents were more shaken than a snow globe in an earthquake. Now, I need you to listen up because these warning signs could save your life or the life of someone you love. If you experience heart palpitations, that's feeling like your heart is racing, pounding, or doing gymnastics in your chest. After drinking energy drinks, that's your heart sending you a text message that says, "Help me." Chest pain or tightness, dizziness, shortness of breath, or feeling faint are all red flags waving frantically at you. If you're experiencing any of these symptoms and you're a regular energy drink consumer, maybe I should see you in the clinic. We need to talk. Here's my actionable takeaway that's easier to follow than a recipe for boiled water. First, limit yourself to 1 energy drink per day maximum, but honestly, I'd prefer you switch to green tea. It gives you a gentle energy boost without turning your heart into a percussion section. Second, become a label detective. Read those ingredients and avoid products with more than 200 milligrams of caffeine. Your heart will thank you for choosing sustained energy over dangerous spikes, kind of like choosing a steady relationship over a roller coaster romance. The bottom line is this: your heart is the most important muscle in your body, working 24/7 without vacation days or sick leave. Treat it with the respect it deserves. Energy drinks might promise you wings, but they could clip your heart's ability to fly. Trust me, the temporary energy boost isn't worth the potential cardiac consequences. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy. And remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.